first thing we're going to do is check for danger. Within the household, danger can take many forms. It can be hot water, it can be an electrical plug. Having a look at this patient, there's no immediate danger around, so we're safe to move on to step 2, which is our response. So I'm going to talk to the patient. Hello, can you hear me? Can you tell me your name? No response, so we're going to move on to a pressure stimuli. Using my hands, I'm going to give a good squeeze on the traps to see if there's any response from this patient. No response, we're going to move on to step S, send for help. Using our mobile phone, we're going to open it up, dial 000, ask for an ambulance and tell them exactly where we are and exactly what's happened. We're going to leave this on loudspeaker so that we can speak through the operator throughout the process. Next, we're going to move on to step A, airway. So what we want to do is check for any obvious obstructions in the airway. Using our thumb and our finger, we're going to open the mouth of the patient, tilt the head, have a look, see if there's anything obstructing that airway. In this case, having a good look, there's no airway obstruction in our patient. The next step we're going to move on to is B, for breathing. What we want to do is have a good look, listen and feel to see if this patient's breathing. So getting my ear nice and close to the patient's mouth, I'm listening for any breath sounds in and out. I'm also having a look at the chest for any form of chest rise and just feeling whether I can see a chest or feel a chest rise there. The next step we want to move on to is step C, CPR. This patient is not breathing and there's no response. So what we want to do, taking our dominant hand, place it in the middle of the sternum, with our support hand locking our fingers together, we want to apply firm pressure downwards and good compressions onto that chest. We want to do 30 compressions followed by 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. After 30 compressions, we want to deliver 2 breaths. And the way we're going to do that, pinching the nose of the patient, tilting the head right back to get good airflow, opening the mouth, we're going to create a seal with our mouth and theirs. 2 breaths delivered, we can see a nice chest rise there. We want to wait for the chest to fall back down before delivering the next breath. Once we've done that, we move on to step D. Step D is defibrillate. Whether it's in a public or a home setting, if you do have access to a defibrillator, we want to follow the instructions on them. The instructions are quite clear and involve sticking 2 pads on the chest of the patient as per the diagram. Pressing the on button will allow for the instructions to give verbal cues for you to follow along. We're going to continue this process of CPR until help arrives, staying on the line to the ambulance the entire time, giving updates and receiving help as needed.